Right now, as you're watching this, somewhere a senior is being handed a pill that will quietly begin erasing their memory. And the terrifying part? Years of practice, I've watched it happen more times than I can count. A sharp, vibrant person walks into my office. 6 months later, their family is asking me why grandma can't remember their names anymore. And almost every time, the answer was sitting right there in her medicine cabinet. A landmark study published in JAMA Internal Medicine followed over 3,400 adults aged 65 and older. What they found should make every senior in America stop and think. Certain commonly prescribed medications increase dementia risk by up to 54%. Not over decades, within just a few years of regular use. Today I'm revealing the 9 most dangerous medications that are quietly triggering memory loss and cognitive decline in millions of seniors. I've ranked them from commonly overlooked to absolutely devastating. And number 1 on this list, it's not a single pill. It's something far more insidious that almost no doctor ever warns you about. But first, drop a comment right now. Tell me what medications you're currently taking, because what I'm about to share could genuinely change your life. Let's begin. Number 9, Diphenhydramine. You know it as Benadryl. It's in almost every senior's medicine cabinet right now. That little pink pill you take for allergies or to help you sleep. It's cheap, it's everywhere, and you probably think it's completely harmless. It's not. Benadryl belongs to a class of drugs called anticholinergics. These drugs block acetylcholine, the chemical messenger your brain absolutely depends on to form new memories and keep you mentally sharp. And as you age past 60, your brain produces less and less of this critical chemical. Every dose of Benadryl pushes those levels even lower. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs like Benadryl had a 54% higher risk of developing dementia. That's more than half again the normal risk. From a pill most people consider a harmless sleep aid. Here's what to do instead. If you need allergy relief, switch to loratadine. That's Claritin. It doesn't cross the blood-brain barrier and is dramatically safer for your brain. And if any medication label says PM, nighttime, or sleep aid, check the ingredients. Chances are it's just Benadryl hiding under a different name. Number 8, Proton pump inhibitors. That's Prilosec and Nexium. Millions of seniors take these every single day for heartburn and acid reflux. Some have been on them for years, even decades, and their doctors rarely mention what these drugs are doing to their brains. PPIs don't just reduce stomach acid. They systematically block your body's ability to absorb vitamin B12, a nutrient your brain desperately needs to protect brain tissue and maintain memory function. They also deplete magnesium and calcium, both essential for proper brain cell signaling. A groundbreaking study published in JAMA Neurology examined over 73,000 people aged 75 and older. Regular PPI users had a 44% increased risk of developing dementia. But it gets worse. PPIs have also been shown to increase amyloid beta plaques in the brain, the same toxic proteins that drive Alzheimer's disease. If you've been on a PPI long-term, talk to your doctor about tapering off with the help of an H2 blocker like famotidine. That's Pepcid. Much safer for your brain. And have your B12 levels checked immediately. Number 7, Oxybutynin, sold as Ditropan. This one is prescribed for overactive bladder and urinary incontinence. It seems practical. Nobody wants to deal with embarrassing bathroom emergencies, but this medication crosses directly into your brain and blocks acetylcholine, the same memory chemical that Benadryl attacks. In a comprehensive 2019 study in the British Medical Journal, seniors over 65 who took strong anticholinergic medications like Oxybutynin for more than 1 year had a 49% higher risk of developing dementia. Nearly 1 in every 2 users. The worst part? The cognitive damage is almost always mistaken for normal aging. Brain fog, lost appointments, misplaced keys. Nobody connects it back to the bladder pill until significant damage has already been done. Ask your doctor about mirabegron, sold as Myrbetriq. It works through a completely different mechanism and does not block acetylcholine at all. Number 6, statins. That's Lipitor, Zocor, and their relatives. Statins are among the most widely prescribed drugs in the world for seniors. They lower cholesterol. They reduce heart attack risk. and millions of people take them without a second thought. But here's what most people don't realize. Your brain is nearly 60% fat. Cholesterol is essential for building and maintaining the myelin sheath, the protective coating that helps nerve signals travel efficiently through your brain. When you aggressively lower cholesterol with powerful statins, you may also be starving your brain of what it needs to function. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who took statins for more than 3 years had a 26% higher risk of mild cognitive impairment. Some patients reported sudden onset memory loss, forgetting familiar names, recent conversations, even driving routes they'd traveled for decades. Now, not all statins are equal. Pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and are considered significantly safer. If you've been on a high-dose statin and you're noticing mental fog, have that conversation with your doctor. Don't wait until the damage becomes irreversible. Number 5. Benzodiazepines, Xanax, Ativan, Valium. These are the pills millions of seniors take for anxiety and sleep problems. And at first, they seem like a lifesaver. They quiet the racing thoughts, ease the panic, help you drift off to sleep. But they are a trap. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years. Those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk climbed even higher for long-acting versions like diazepam, which accumulates in your brain tissue over time. What these drugs actually do is create a chemical sedation that progressively slows down your entire brain. It stops learning. It stops adapting. Seniors on benzos describe feeling like they're moving through constant fog, disconnected from reality, not feeling like themselves anymore. And when they try to stop, withdrawal symptoms, severe anxiety, agitation, crippling insomnia make the drug feel essential when it's actually the source of the problem. If you've been on a benzo for more than a few weeks, never stop suddenly. Work with your doctor to taper very gradually over weeks or months. Buspirone, a non-sedating anti-anxiety option, or cognitive behavioral therapy can help restore calm without destroying your memory. Number 4. Amitriptyline, sold as Elavil. This is an older antidepressant that's still commonly prescribed today, not just for depression but for chronic pain, insomnia, and migraine prevention. It seems like a versatile solution, but amitriptyline is one of the most potent anticholinergic medications still in circulation. It blocks acetylcholine so aggressively that cognitive effects aren't just a possible side effect, they're an expected consequence of long-term use. In the landmark JAMA internal medicine study, seniors who took higher cumulative doses of anticholinergic medications like amitriptyline over 10 years had a 54% greater chance of developing dementia. Even low doses taken nightly over several years create a slow, invisible erosion of brain power. The damage happens silently. No clear symptoms at first, just a gradual decline that looks exactly like normal aging, but is actually drug-induced. For nerve pain, ask about duloxetine or gabapentin. For sleep, try melatonin or low-dose doxepin. For mood support, sertraline or escitalopram are dramatically safer for your brain. Number 3. Paroxetine, sold as Paxil. This one is especially deceptive because it looks like a modern, safe antidepressant. It's an SSRI, the same class as drugs like Zoloft and Lexapro. But paroxetine has a dirty secret that separates it from every other SSRI on the market. It's the only SSRI with significant anticholinergic properties. That one detail makes it fundamentally different from its siblings. In a comprehensive 2021 review published in Frontiers in Psychiatry, seniors taking paroxetine showed measurable declines in short-term memory, verbal recall, and attention span within just 12 months. They were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The American Geriatric Society has officially placed paroxetine on its Beers criteria list, medications considered potentially inappropriate for older adults. If you're on it, ask your doctor about switching to sertraline or escitalopram. Same benefits, dramatically less risk. Number 2. Antipsychotics, Seroquel, Risperdal, Zyprexa. This one makes my blood boil. These are powerful drugs originally designed for severe psychiatric conditions like schizophrenia and bipolar disorder. But today, they're being routinely prescribed to elderly patients in nursing homes for something as minor as restlessness or trouble sleeping. Let me say that again. Drugs designed for schizophrenia are being given to your grandmother because she's confused at night and the staff wants her quiet. A 2022 study in The Lancet followed over 25,000 older adults. Seniors prescribed antipsychotics were 71% more likely to develop worsening cognitive decline within just 12 months, even if they had no prior history of dementia before starting the drug. These medications crush dopamine levels in your brain, the chemical responsible for motivation, executive function, and memory processing. That's why seniors on antipsychotics often appear dull, emotionally flat, completely zombified. Families watch their loved one fade away and assume it's the disease progressing. It's not. It's the medication. If you have a loved one in a care facility on antipsychotics, ask the hard questions. Why was this prescribed? Is it medically necessary, or is it for staff convenience? In most cases, structured routines, reduced noise, better lighting, and addressing underlying pain can manage behavioral symptoms without chemically sedating the patient. Number 1. Anticholinergic Polypharmacy. You might have expected a single pill to top this list. But the most dangerous medication threat facing seniors today isn't one drug. It's what happens when you take multiple anticholinergic medications at the same time without anyone connecting the dots. Picture this. A senior takes Benadryl every night for sleep, Oxybutynin daily for bladder control, Amitriptyline for chronic pain. Each pill alone might cause only mild memory issues, but together they compound exponentially. The anticholinergic burden on your brain skyrockets. A 2022 analysis published in Age and Aging tracked over 280,000 older adults. Those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. And here's the devastating part. The vast majority of these seniors had absolutely no idea they were even taking anticholinergic medications. Nobody ever explained it to them. No doctor sat them down and said, "These 3 pills together are erasing your memory." But here's the most powerful thing I can tell you today. Drug-induced dementia is often reversible when caught early enough. When the medication burden is lifted, many seniors dramatically regain mental clarity, energy, and memory function within just weeks or months. Your brain is remarkably resilient, but only if you give it a chance. Here's what you need to do right now. Ask your doctor or pharmacist to review every single medication you're taking, prescription, over-the-counter, and supplements, for their anticholinergic load. There are tools that calculate your total burden score. Once the problem medications are identified, you can work together to deprescribe safely, switch to alternatives, and give your brain the chance to heal. Don't wait for the fog to get thicker. Don't assume it's just aging. It might be your pills. Tell me in the comments, which of these 9 medications are you taking right now? And have you noticed any memory changes since starting them? Your story could help another senior avoid this same trap. I'm Dr.